morning. I would like to welcome you to this roundtable and thank the Global Network for NTDs, the World Bank, and the Bill and Melinda Gates Foundation for their sponsorship. I'm sorry that I cannot be physically with you today in Berlin due to prior commitments. We are close to turning the tide for the neglected diseases that affect the poorest of the poor around the world, especially in Africa. This past September, the 63rd Regional Committee of WHO for Africa endorsed a regional strategy and the Regional Neglected Tropical Diseases Strategic Plan for 2014-2020. During the same event, WHO and member states adopted a resolution to achieve the eradication, elimination, and control of targeted neglected tropical diseases by 2020. I also want to inform you that the 6th Conference of the African Union Ministers of Health, held in Addis Ababa earlier this year, acknowledged the need for the African governments and development partners to increase support for neglected tropical diseases control and elimination. Significant achievements have been made over the last 5 years in reducing the impact of neglected tropical diseases on the African people. For example, Guinea worm disease, which was previously endemic across the tropical world, is about to be eradicated. 4 countries, namely Chad, Mali, Ethiopia, and South Sudan, are still to achieve this target. In addition, the mass drug administration for lymphatic filariasis, for example, has increased significantly from less than 50 million in 2009 to more than 120 million treatments in 2011. 36 African countries in our region have developed their own multi-year national plans to control and eliminate neglected tropical diseases. These plans also provide estimates of resource gaps and requirements. I am pleased to note that the global health community is rallying together to support the new course towards a world free of neglected tropical diseases. We need a sustained support from all stakeholders to fill the financial gaps, which will help ensure that well-designed national neglected tropical diseases plans are fully implemented and reach the 2020 goals. WHO is urging governments to increase their domestic investments in health while advocating for increased international health partnerships and funding. Let us mobilize the necessary resources needed to end the threat of neglected tropical diseases in our world. I wish you successful deliberations, and I thank you for your attention.